I want to thank God. Thank you for the word that you shared today, and I'm definitely needed, especially these time and days, with everybody going through. I also want to thank Miss Monica Rockwell for definitely hosting this meeting. Met her at the Albany Housing Authority, and it's amazing how God, orchestrate things and bring people together for a reason. And so I was sitting right beside her, and so we got to talking during lunchtime. And so I was like, okay, what do you do? She said, what do you do? And she was like, hold up, I need what the service you have. And so that's what the key thing to the Bible said, my people perish due to lack of knowledge, okay? And so I'm not going to preach today. But but I do believe that God give you a talent, and whatever talent you have, you're supposed to use it to glorify God. And so pretty much y'all. So just like that song said, this little light of mine, I'm gonna let it shine. So throughout my career, that's what I do. Well, my name is Keith Dykes. I'm from Albany, Georgia. Pretty much former occupations, been a deputy sheriff for 16 years for the local Dougherty County Sheriff Office. And throughout those terms, I pretty much always had a passion for helping people out. And so that's what I did throughout that time. And so back in 2004, someone brought some knowledge to me about insurance. And I was like, whoa, this is information that I didn't know. So if I don't know this, I know my family member, my people don't know this information. And I said, okay, I'm going to make it my business to pretty much make sure that my people have the right service. And so I was like, hold up. So I'm going to send this man over to my family house to help them out. And I was like, hold up. I was asking God for a career change. And I was like, hold up. Now, and so I said, hold up. I said, do you get paid for these? He said, yes. And so from that point on, it's been history. So ever since then, pretty much God had blessing us with the talent to share the information. And that's all we do, just share information, just bring people together with the right resource and make sure they can, get the things that they're lacking of. So one of the fields that I specialize in, the Medicare field, there's a lot of information that associated with Medicare. A lot of people don't understand how it works. And so my job is to simplify it. One of the things that we do is called a benefits checkup. Benefits checkup, if y'all mind if I pass one of these right here, that's okay? Okay. All right. Yes, appreciate it. And by the way, this gentleman right here, y'all know he kind of favored me a whole lot, right? That's my son. So, yeah, so I'm proud of my son. This is just got licensed, so starting this new career. So, okay. Give her one of these right here too. Okay, and that should be it. Okay. So we're gonna start off with the benefits checkup. Okay. Benefits checkup is sponsored. It's designed by the National Council on Aging. And so it's a lot of benefits and service and resource that a lot of senior citizens missing out on. As y'all can see on the brochure, is that there's over 2,500 benefits program available nationwide. Okay, find out what benefits may be available in your area. And so Sewega Council on Aging did a fantastic job by bringing resource together and bringing that resource together, pretty much show them exactly how to get the things that they're missing out on. Now, everybody's needs may be different. One person say, hey, listen, I need having an issue with hearing, okay? And so what they do is, okay, find a resource that help you out with your hearing, maybe medication. So these right here is that we can go along with this little chart right here. And my job is to find out the area that people miss out on when it comes down to medication, health care, income assistance, food, nutrition, housing, utility, tax relief, veteran, employment, and more. So National Council on Aging came up with a system where the person can go in the system and create a profile, and that profile pretty much will navigate them. It's a personalized profile for everybody, and so that database will pretty much say, okay, this right here where you can go, where you can need food if you, lack of food or whatever the case may be, you need some utility, some help with utility, you can go to this resource. And so, like I say, it's all in the community that's within you live in, like I say, it's a private, secure website that National Cancer Agent does. So go along with this right here. One of the things that I noticed that a lot of people come down to lack of knowledge when it comes down to the Medicare. Okay, when it comes down to Medicare, there's a lot of things associated with it. Now, everybody know what Medicare look like, right? Sometimes people get it confused what Medicare card look like. I asked, do you have Medicare? They say yes, and they pull out a Medicaid card. And I'm like, no, that's not a Medicare card. And you can show you an example. You got it? Yeah. There you go. Yeah. I believe some people was hoping that they have a Medicare card, hoping that they can get more benefits, but they showed me a Medicaid card. I'm like, come on now, that's not red, white, and blue. Well, they tried to put a little red on it. I said, no, that's still not the same. Well, Medicare card, pretty much red, white, and blue. It pretty much just have two letters on. Most time it have two letters on it, A and B. Okay. The A stand for hospitalization, and the B stand for help out with your doctor, and so what. And so with that B come along, B come associated with a fee, and so that B come with a fee according to how much you earn throughout the lifetime, how much you paid in. That's pretty much what determine whether you qualify for a B. And also with the fee come along with B, a lot of people first get the letter saying, okay, you have to pay this much for Part B, and they said, do you want Part B? And most people on the fixed income, what most time their first decision is going to be about. Yeah. Yep, exactly. They was like, oh no, In the back of it says, check out this box, send it in. Hey, you won't have your B. And so I run across a lot of people but a lot of people qualify for the state to pay for that Part B for them, not knowing it. And so what I do pretty much, look at the income and pretty much see exactly what's associated with, and help them out, and so the state can pay for their Part B. And this right here was, this right here pretty much what a Medicare card look like, okay? And so for example, this right here is Medicaid, okay? So Medicaid look like it's right here, and this right here is Medicare. Okay, and so with the Part B, the state have different programs that will pay for your Part B premium for you if you qualify for it. And I tell people, a lot of times people put the wrong information on the form and get disqualified from it. And so if you can look at this form right here, this second form. Right, there you go, Medicare Saving Program. And this is a program pretty much that help out with it's called a Qualified Medicare Beneficiary program called QMB, abbreviation for that. This says right here, an individual monthly income is limit to, how much is that? Okay, so a person income of that, now they qualify for QMB. Okay, married couple monthly income limit is $1,430. Individual resource limit to $7,730. Married couple resource limit to $11,600. Okay, now what people make a mistake when it comes down to filling out this form right here, to be approved for it, they put down the cars and the homes, and that pretty much disqualify for them, because that calculates an income, and that pretty much have them disqualified for it. And what the state looking for is investment property, like your house, rental property, or either like taxi or using your car for Ubers, things like that. That's what the state looking for. Okay. Another thing that a person need to qualify for, also put in for what you call it extra help through Social Security. That pretty much help out with your drugs and help pay your premium and other resource, other things like that also. Now, on the next page, what I was speaking about, we flip over to the next page, we'll see the note right here. Okay, it says what item are included into Medicare saving program resource limit? Okay, countable resource include money in your checking or saving account, stocks and bonds. Okay, countable resource don't include what's those things are. Okay, and so I ran across a young lady, and she pretty much definitely qualified to receive for the state to pay their part B premium for her. And she was like, "Well, I know why they turned me down." I was like, "Why?" She said, "Because I got my new car." I was like, "Okay, you got your new car? Did you put that down there?" She said, "Yes." I said, "Well, you didn't have to put that down there. That would qualify you to get it." So what they did is that they look at that $15,000 car as resource, and so she went over her limit as resource. And so, not saying that to tell her to put anything fraudulent or anything like that. It's just pretty much how you have to word it the right way and fill out the application the right way in order to get qualified. Then she went back and she got qualified for it because the income met her bracket. Because a lot of time when people inherit, let's say a person inherit uncle passed and leave the person in the will, gave them $1 million mansion, and but yet they still on the fixed income, and so they pretty much put the $1 million mansion on the application they disqualify for, and so but yet they still gotta pay the bills and things like that, still on that fixed income. That's what the main thing they look at. And so, like I said, my job is to simplify the information and make sure that people getting all the resource that they can get. We also partner with the housing authority. We also partner with the doctor's office, local community activity events and things like that, just to get the information out there, because definitely people definitely need the service. Also with the local food banks, not only the local food banks surrounding counties, we also partner with them also, and give a helping hand where we can help out in the community enjoy doing, that love doing, and so that's what we do. So definitely, again, right now, if anybody have any questions, some of the information, yes, ma'am. Mm-hmm. Okay, yeah, yeah, appreciate that. The people that qualify for Medicare, okay, to qualify for Medicare, there's several ways you can receive Medicare. One of the most common ways when people are aging in, what they call aging into Medicare. Those are people that pretty much work within a specific time. Most time work about 30 years. By the time they reach age 65, they pretty much invest in enough into Medicare. And when they retire, when they turn 65, Medicare pretty much automatically kick in. And that's one of the most popular ways where people receive Medicare when they turn 65. Another way, when people paid in enough quarters in within a specific amount of time, and they get injured, get disabled before 65, but yet because they had enough paid into it, and then that's when once they go on disability, most of the time about 24 months later, that's when Medicare kick in to get received Medicare. And another thing is that when some people that have children under age 18, if the parents deceased, the kids pretty much will inherit. They pretty much Medicare, and you got a widow. So there's several ways you can receive Medicare. But once you receive Medicare, that's pretty much that's most of the ways where people receive Medicare benefits. So I believe did I answer your question? Oh, okay, okay. And so not only just senior citizens receive Medicare, it's some kids. So it's varies. My brother, he's younger than I am. He received Medicare, and because he got hurt, prior to age 65, and so we're able to help him out also. Okay, good question. Some of the reason, probably the reason why he didn't receive it, because he didn't pretty much um, work as place where they can pretty much report his income and be able to pay in towards Medicare throughout that time. And a lot of people that did farm work, housekeeping and whatnot, and it was getting paid, by whoever they're working for, they didn't report that income paid into Medicare, and that's pretty much, they didn't have enough quarters in. But what I tell people like that, best thing to do is please go down to Social Security and talk to them. They'll pull your information up and they'll tell you exactly how many quarters or what you have to have in order to receive your benefits. And some people, believe it or not, they just pretty much like about a few months, whatever the case may be, to get their Part B premium, And so they go down there and they check in. They pretty much, of course, they disabled, but yet you got certain things that you can do, an income limit that you can make whenever you get on assistant. And what they can do is go work for Goodwill part-time, a few hours a week or whatever the case may be, somewhere, where they can pretty much do the work. And then that they have enough quarter that kick them into Medicare, and then they get their Medicare. So again, the best thing you need to do is go down to Social Security and find out the facts, And the key thing to it, just like if a person has a sickness, you want to go to the core, you want to find out exactly what's going on, get the true facts. So the true facts is Social Security Administration that pretty much govern and regulate your Medicare. So that's what you need to do, go down there and talk to them one-on-one and find out the facts, exactly what he got to do. Then he'll know exactly, what he got to do to get it. Yes, ma'am. I recommend when sorry, so that I get tongue tied. My thing is right here. When a person reaching the age, I would say about 60 to 62, you want to probably, start getting some information about, start attending seminars or whatnot, about Medicare, because you won't want to wait till that time come. And then when that time come, a lot of people get overwhelmed calls, letters, and they're confused exactly what to do. And then sometimes people get calls in where they pretty much was told that, hey, this premium gonna cost you at least about $300 to $400 a month. And once people get that first price or quote, they're gonna shut down to the majority of all the stuff and cause things like that. And then that pretty much cause them to they go into Medicare scared and frightened and tone everything out, and then they miss out on a lot of benefits that they have. So I suggest that when you reach age 60, 62 years old, just start having an open mind, start looking and going to seminars, just like Miss Rockwell, hosting seminars dealing with their Medicare. So that's one of the things. So around 60 to 62 years old. That a lot of times, things change, just like, nothing to stay the same, I remember I used to look like him. Things change. Now, when it comes down to hair now, that was a choice that I did. I cut my hair off. And, so I didn't want to go to the barbershop. Then, so lady said, well, you got a bald head because you can't grow no hair. I said, yes, I can. I tried to grow it back. I said, uh-oh, I made a mistake. But things change. So when it comes down to your benefits and resources, when it comes down to Medicare especially, you want to pretty much make sure you have a local agent that pretty much help out a whole lot, because a lot of people communicate and deal with the service over the phone. They get frustrated and confused exactly what's what, can't get in contact with the person. So that's why I encourage people to definitely get someone that you know locally, so that you can pretty much be able to pretty much contact, and that person be able to come to you, sit down with you, and get it with them. Because you got every year, benefits change, company change. I remember years ago, people used to holler about blue, can't call the name out, but blue this, we're on the job, but blue gone now. So I'm not calling name out. But things change, even though with the plans and things like that, service. So every year you want to pretty much definitely get with someone, attend a meeting, seminar, so you can get the updated information on the services that are in the area. Yes, ma'am.
What is the limit for each household with the amount of income coming in for you? So, what is the limit for each household? They have a limit. I think Social Security have a limit. Does it go up every year? It stays the same. It's
Uh,
just like so much income can come in one household to qualify for certain things.
Okay. Yes, that's pretty much certain benefits that a person qualify for. Like you say, you got your QMB, you got your extra help for drugs, for the help pay your premium. So each one of them got different limit. So pretty much, it's all according to what service that you're trying to register for. So we pretty much, so that's all according to what service you trying to get.
I got one more
Yes,
question.
ma'am.
Okay, when do you, at the age of when you get, what age do you have to be to start doing filing for income tax? Because one guy told me you don't never finish as long as you get income. I'm 87 years. I said, when do you start filing for you don't have to fill out income tax? He said, as long as you get an income with a certain amount, when you get over 50, a certain amount of money coming in the house, you have to file.
Well, that's out of my field there.
Okay.
I was told two things. I was told two things when it come down to taxes,
Uh-huh.
and two things that for sure that you're gonna do. Everybody know them two things, right? So yeah. Well, pretty much.
Affected Medicaid and Medicare? Oh, great question.
Good question. Good question. When it comes down to Medicare, it did not affect the service. Matter of fact, it's enhanced the service. Pretty much all the companies, most of the carriers, pretty much biked up saying that, hey, listen, we here for our client. We here to protect our clients. We here pretty much to do all we can. So when it come down to the corona virus, they pretty much assisting out with the testing and also with the emotion support. So they're doing a great job on that. You know, the people that come in contact with that with that virus.
Can you go into more detail when you're saying that they're assisting with the testing? What do you mean?
They're gonna waive the fee. They're gonna waive the fee for testing because one of the things that people when it first came out, some people that want to get tested, and some of them, but they insurance wasn't allowed. So that's one of the big issue when it first came out. Well, is this covered under my insurance? And so most of the carrier now pretty much stated that, hey, we're willing to pretty much to back up the testing and things like that. And so they're doing a fantastic job on that, on getting that under control. So
And the emotional support, how does that?
people that have it, they have pretty much I forget the exactly title name for it. They pretty much service that they have when people going through it, because a lot of times people go through that, have depression and whatnot. They have emotion support that pretty much a nurse that pretty much can aid and coach and help out with the emotion stress that a person going through when they go dealing with that. Right, dealing with mental stress. Uh-huh. So they're doing a great job on helping out. The majority of all the plans, they pretty much backing it up now.
And is it safe to say that that's at no charge to the person?
Yes, no charge. Most of the carriers. That's pretty much for right now.
So I have another question. So you were mentioning earlier it's best to kind of sit down with an individual and kind of help them walk through the process. So would that be you, for example?
Yes, ma'am. Yes,
So
ma'am.
do you have like you're on social media? Any? How would I if I need to? I need to refer somebody to you. Would I do it to you so they can actually, because you may talk them through to where they can clearly understand it versus trying. They still have to go through steps to go through the program to get what they need. But if they start, can they start with you and then go from there and kind of walk them through? If so, how can they reach out to you?
Yes, ma'am. Appreciate that. My name is Dykes. You can reach out to me by my name. Also, pretty much they can pretty much. Well, one of the things that's why we partner with a lot of resource agency around surrounding county. So with the food bank, the people that are in charge of that, housing authority, the doctor's office, the dentist, the eye doctor. So we partner with a lot of resources, and we got cards in the community and information in the community how they can contact us. But one way, pretty much, you can call us at 229-854-4847. That's my number. You can contact me. But yes, we suggest that pretty much people definitely reach out to us because we have like quite a few agents that in surrounding county that pretty much we work together and help the community out. So we're just not just in one location. We're in surrounding counties and broad. So. Okay. Well, definitely, I want to definitely thank Miss Monica Rosswell for definitely inviting me. It's been a blessing to meet you also, and awesome job you're doing. So definitely keep you in prayer and may God continue to bless you and support you in the help.